Welcome back to another exciting episode of Paladin Financial Talk. I am your host today, Ellie Robison, joined by my always co-host, Tony Shore. Hi, Tony.
Hey, Ellie, great to be here with you once again.
I
I'm
love seeing
excited.
you.
Yep, it's fun. We've been talking about the great Minnesota get together, the state fair, and
Yes.
you went just last night.
Yes, and I'm catching a little bit of a cold, so full disclosure, I might sound a little sniffy on this podcast today, but had a blast yesterday at
Good.
the state fair. My sister's in town from San Diego, and she's here for a week, and so we're maximizing our time together.
That is so fun. I
Yeah.
love to hear that. And I haven't been yet this year,
You haven't?
but I'm going soon,
Okay, good.
probably tomorrow.
Okay.
Yeah.
It should be good weather here in Minnesota from here on out. We had a bad storm on Monday.
Really bad Monday at night and into Tuesday morning. They shut the fair down. And that's a big deal in Minnesota because the Minnesota State Fair is the second largest in the U.S.
Is it?
state fair.
Oh, I didn't know
And
that.
actually, it's only second because Texas, their fair runs a full 2 weeks. Ours
Okay.
runs a week and a half.
Yeah.
But if you have single day totals, we've had the record many times.
Okay.
Yeah, about 200,000 people a day.
That's so many people. And there was a lot of people there last night too.
Yes. Oh,
I was
I'm
thinking,
sure.
yeah, for a Wednesday night, I was like, oh, there won't be that many people.
Oh,
But I
there's
think it was
always.
the weather that brought people
Yep,
in.
it's packed.
Mhm.
So you have a great show lined up, and you've got a
Yeah.
huge get for a guest today.
I
Tell us about
do.
this.
Well, we're wrapping up this month's series called The Complete Guide to Health and Wellness, where Nikki Foley really on our team has been the most active recording on the podcast this month. She's very passionate and just heading up the Medicare services that we are doing at Paladin this year. And she's just been coordinating with the health space and kind of coinciding that with your retirement plan.
Right.
So as we age, it's natural for our bodies to go through changes, which Nikki had been addressing prior on this podcast this month. But what is often overlooked is the mental health challenges that come with getting older. Anxiety and depression are increasingly more common in adults now. So that can stem from various factors such as the loss of loved ones as you age, the transition into retirement, or even the physical decline that limits independence. We see that. So I wanted to focus a little bit more on that for today. So that being said, anxiety and depression, it's something that can affect people of all ages, not just people who are entering into retirement. So it doesn't just impact your emotions, but it impacts your decision-making abilities and your physical wellness as well, which ultimately then can affect your components of your financial life, right? It's like a chain of events.
Yeah.
So today, I wanted to spend some time on stripping that down and just hone in a little bit more on mental health and what that means. So today I am joined by a special guest he's actually out in the West Coast. So he's
Awesome.
joining in over Zoom here just to understand mental health more. So Joey Ekholm is the brother to one of our newer members at the Paladin team, Jack Ekholm, which he has been on the podcast once before. And
Yes.
he is a paraplanner at Paladin. But Joey here, he graduated from the University of Wisconsin, Madison, with a Bachelor of Science in Neuroscience and a Bachelor of Science in Nutritional Sciences, as well as a certificate in Global Health. So Joey now has been gaining experience at a startup mental health company for at least 3 years now, a little bit more than 3 years, focusing on psychedelic medicine and providing at-home ketamine treatments as an alternative and or injunction to traditional mental health treatments. So welcome to the show, Joey.
Thank you so much, Ellie and Tony. I'm super excited to be a part of the show and able to translate some of the things that I've learned along my own mental health journey and professional experience in the field, continuing to grow and develop and work alongside patients, as well as continue my own journey with mental health and well-being and in the medical space. So yeah, I'm super excited to be on the show and provide insight and support to anyone listening. So
That's
yeah.
awesome. Joey, remind us, where exactly are you in the West Coast?
I am in Venice, California. So
Venice, okay.
Venice, nice. I
Yeah.
love Venice.
We're talking about the weather here being nice in
Yeah.
Minnesota for a couple days, and you have it nice all year round.
Yeah, always sunny and 70. I used to live in Southern Cal. I used to live
Oh, really?
right on the edge of Costa Mesa and Newport Beach down in Orange County.
Oh, okay.
Lived
Yeah.
there for
Very
about
nice.
5.5 years. Yeah.
Yeah.
Yeah. I'm definitely in kind of like the microclimate area in Venice right now. So it's been like cloudy in the morning. So I
Oh,
do have a little bit of leverage to complain about that, but otherwise,
right.
I
Yeah.
can still guarantee the sun will be out later, and
Yeah.
it'll be 70 or 80, and I'll be hot and
Yeah.
in the sun. So I really can't complain on that front.
Sure.
You're living the dream. Well, Joey, tell us a little bit more about why you entered into this field and how are you using your degrees today?
Absolutely. So I became passionate about the medical field in general. Just fascinated by the human body, the anatomy, physiology from a young age, and that's kind of where my whole passion about the medical field started. And then it wasn't really until I started my own mental health journey. I was diagnosed with anxiety, depression, and an eating disorder at the age of 15. So it's been kind of 10 years of experiencing that, working on myself and being on that front edge of working through a bunch of different modalities through traditional medicine as well as like holistic wellness. Practices such as meditation, breath work, journaling, alongside cognitive behavioral therapy, different treatment programs. And so this kind of past 10 years has been really focused on mental health and then adapting that to helping other people as I've, worked alongside myself and in group therapy, also seeing other people as they've experienced it and kind of taking that passion for the medical field and specializing more on the mental health space and seeing how critical it is in terms of how one can really make the most of their life and how mental health really stems into every single aspect of one's wellness and well-being and how the just the interaction between your mental state and your physiological state is so critical and something that's generally overlooked, and so that's kind of brought me into the field, and then currently working, as you mentioned, Ellie, in the psychedelic focused and medicine space, just as another alternative treatment course, as through my 10 years of work on myself and going through the traditional pathways of therapy, outpatient, inpatient, residential, and seeing how sometimes you don't always find alleviation. So there are people with treatment resistant indications. And
Mhm.
so being able to provide hope in any aspect is something that, I find to be really, really inspiring and something I'm very passionate about is seeing people light up and find that relief from the distress and any ailments that they have.
Yeah, that's amazing, Joey. I'm going to admit I feel a little naive when speaking about mental health. I feel like I don't know what I don't know. And I feel like you hear the terms anxiety and depression all the time. It's just thrown around. If anything, I feel like maybe the younger generations may be using those terms a little too loosely when describing their emotions. While I feel like, and this is just a feeling, this is, based on my own interactions with just everyday people, is maybe older generations might be in denial of those kind of disorders of anxiety, depression. So, how is mental health defined and how is it identified exactly in the medical community?
Yeah, yeah, that's a really, really important note to make regarding anxiety and depression, and something that's vastly different among the generations and misunderstood broadly.
Mhm.
So to kind of circle back to your question about defining mental health, so in the medical community, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. So people with good mental health can think clearly, meet challenges, be responsible, and have good relationships with others. Mental health is important at every stage of life, as you mentioned, from retirement, from young age. It affects how people think, feel, and act, and it also helps people handle stress, um, relate to others, and make healthy choices. Disorders manifest when the well-being and balance is off and causing distress on the individual, typically unable to meet daily responsibilities or struggling in this aspect or just finding challenge in every day. And so to focus on anxiety, it's a normal response to stress, and can even be beneficial in some situations because it does increase focus and attention. And so if you think of how the body and the mind adapted, when post stress comes on is having anxiety can be beneficial in terms of coping, but it's when it's on that persistent basis. And so when you're looking at the diagnostic criteria in the DSM-5, the clinical diagnostic and statistical manual, that's kind of the holy Bible, if you will, for psychiatry and the medical field in terms of defining these mental health disorders, as well as listing how clinicians can diagnose and treat and see the symptoms. And so it just it the DSM-5, it describes anxiety as excessive worry and apprehensive expectations occurring more days than not for at least 6 months. So think about that as, somebody might wake up and say, "Oh, I have such bad anxiety today." And so although that's it can kind of be off-putting to kind of put that label on it, as you mentioned, and kind of use it so willy-nilly when really it is kind of an ongoing um, symptoms that can include, worry, tension, physical symptoms such as restlessness, feeling on edge or easily fatigued, difficulty concentrating, muscle tension, problems sleeping, a breakdown in kind of the day-to-day functioning that happens on a recurring basis. And then, specifically about anxiety, it can even break down further into phobias, panic disorders, social anxiety, separation anxiety, generalized anxiety, and a few other anxiety indications. And so it's not just a single "I have anxiety." It really does break down into these more specific buckets, and you and your clinician can work together to look at your symptoms if that's something you are experiencing on a long term basis, and kind of find the most specific indication as that provides the clinician and you with more information on how you can find treatment. And so that's anxiety, and then in the depression side of things, it is a common and serious mental health disorder that negatively affects how you feel, think, and act, and perceive the world. And that can be further broken down into disruptive mood dysregulation disorder, major depressive disorder, persistent depressive disorder, premental dysphoric disorder, and then depressive disorder due to other medical conditions. So again, there's a lot of different further specializations of depression. But common features of all depressive disorders, such as are like sadness, emptiness, irritable mood. Again, those physical manifestations of it, cognitive changes, sleep disturbance, loss of interest, appetite, pleasure, suicidal thoughts, depressed mood. And so, because of false perceptions, nearly 60% of people with depression actually do not seek medical treatment or any sort of help. And this can really stem back to that stigma of mental health. That's it may not be acceptable in society or in that person's life, or where they grew up, or how they might experience those things. But there are, great evidence in the traditional mainstream medicine that, antidepressants or talk therapy can be really beneficial. And then, what you note in terms of the difference between generations. Again, the older generation tends to disregard, push down, or try to like white knuckle it through these mental health challenges. And this active work to kind of not recognize and bottle up emotions can really actually lead to more discreet like suffering and coping, as it tends to kind of be pushed aside and bottled up in that subconscious, but then can really, as I've seen through my own work with patients, it finds ways to bottle up with what physical manifestations or other ways of substance abuse or dependence on other, bad coping mechanisms. And so even though you are pushing it down and you're kind of disregarding it, it does have ways to kind of circle back up. And then on the other hand, the younger generation, as I mentioned earlier, will just kind of throw this terminology and language around like, "Oh, I have anxiety today," or "I kind of feel depressed." This often can kind of take away from the seriousness and kind of the importance of really identifying this long standing and a common occurrence that everybody has, or that more necessitates treatment and yeah, kind of really looking deep and finding help from a clinician and a professional to really find the the best treatment to really hone in on that mental health. So
That is so detailed, Joey. Like, just hearing you talk about it sounds like a spider web. Like, I don't know if this makes sense, but like anxiety and depression, like it sounds so just broad. And once you start diving into like there's multiple like subsectors almost
Layers.
layers, I was like, I am so naive to this. I had no idea. So, do you have any statistics on how prevalent like anxiety and depression are in today's society?
yeah. So looking at the most recent statistics, particularly from the National Alliance on Mental Illness, so a really well-known organization that does these statistical surveys on a yearly basis, they found that over 20% of American adults, so more than 50 million individuals, experience some sort of mental illness every year.
Wow.
And then from statistics for 2024, they found 19.1% of US adults are affected by anxiety, so the most prevalent, while 8.3% are affected by depression.
Wow.
And as I mentioned with the broad buckets, the 8.3%, that's major depressive episode.
Mm-hmm.
So that's 6 months or more of certain symptoms defined by the DSM-5. And then it is important to note that these are self-reported surveys, so it is based on the self-report of the sample that's selected for the surveys. Therefore, they are going to be based on how the participants elect to answer. Again, whether truthfully or not, if they want to, not indicate that because they see it as some sort of negative on their own mental health or like their own ability to cope with things, or if they want to be kind of more aware. So it does again come down to that kind of self-awareness and ability to recognize these mental health challenges and see it as something. Okay, I haven't been diagnosed, so I'm not going to say I have it,
Mm-hmm.
anxiety or depression, even if, they do have all the symptoms and they do meet the criteria. And so again, raising awareness and really being able to introspect and kind of take a step back and objectively view things. Again, that can be really helpful to find a mental health professional to help you do that.
Mm-hmm.
That really makes the most of identifying and finding and kind of being able to self-report. So again, that kind of circles back to the numbers are really astounding with the 19.1% of anxiety, 8.3 with depression. But again, it does come back to that self-awareness and ability to uh, see that in oneself and willingness to report that.
I mean, I feel like it's understandable for some people not wanting to self-report and maybe not in just terms of not wanting to admit it within themselves, but just in general. What I'm thinking is like on the finance side of things, like I might be issuing life insurance for a client who might need it. And I haven't seen this firsthand, but I know that life insurance companies, when they're underwriting for someone, they're going to be looking at your medical records. And if there's severe enough mental health issues, they could completely deny coverage for you.
Wow.
I know that is a thing. I haven't seen it, but I know that is a thing. So they're taking a look at all the pharmaceuticals that a client might be taking and just assessing if they have their mental health in order, I'd say, or at least is maintained and taken care of. So it kind of affects your finances in that point where maybe people don't want to self-report and I don't know, just be honest with themselves. But again, life insurance is a little different because they're diving into your actual medical records and everything's in writing straight from your doctor. So
Yeah.
that's the only side that I'm really seeing it there. So, Joey, in the event of an individual or their loved ones like potentially declining in their mental health, where should one begin in finding resources for themselves?
Yeah, that's a really amazing question, and, fortunately, there are a vast array of options available to start your search for support. Um, the very first thing, I would start with your primary care physician. as typically people have some rapport with them. The PCP and general practitioner have some background on kind of your medical context and medical history, and you're able to share your current experience and provide. They can provide direct care and a referral to a specialty mental health care provider, such as a psychiatrist, a therapist, and others. Alternatively, if you don't have a great relationship with a general practitioner, you can always look to directly schedule an appointment with a psychiatrist, preferably in network with your insurance. This will make it really affordable. And you can always call. Your insurance companies have a contact information that really help you find who is in network and who you can see on an affordable basis. It's also important to note that a psychiatrist is a licensed medical doctor that has specialty and has gone extensive knowledge beyond medical school in treating patients with mental health conditions, and they can diagnose and prescribe medications. Whereas a therapist, they've completed master's level education and can provide talk or psychotherapy and create medical treatment plans, but cannot prescribe medications.
Mm.
Often both can be seen concurrently to lower the cost burden in terms of not just going extensively with the psychiatrist for longer visits because that's more expensive, but finding kind of that specialized therapist to do longer sessions. And so I recommend reaching out to your insurance company to help find an in-network provider that you can with whom you can explore treatments at a covered cost and only have to pay a smaller copay. Furthermore, there are many organizations that excel in supporting those seeking support. So, one I mentioned earlier, a really big network found throughout the U.S. is the National Alliance on Mental Illness. So, they have a robust website with extensive self-led resources, education materials, defining mental health and everything in that regard, as well as assisting in finding professionals and much, much more. So you can find that on their website. You can also give them a call. They have a helpline, at 800-950-6264 if you want to try to remember that number, or you can even just text them helpline to 62640. And then they do have a crisis number if you are in need of immediate mental health assistance. 988 is the phone number for mental health crisis number. It's also important to mention that reaching out and sharing with a loved one can be a critical step. So, in getting support and easing some of the burden of going at it alone, being open and vulnerable, it really deepens the relationships and takes great strength, but ultimately allows you to receive the encouragement and trusted care of another. Because it's really important to know that you are not alone. And a lot of times, when I've shared my own story and just been open to it, although it's really difficult to share your own experience and kind of admit where you are needing help. Um, Again, you're finding that's over 60% are struggling with mental illness. So opening that line of communication can be really, really critical in finding the care that you need, as well as even helping somebody else finding care. So it is kind of something that leads to more selfless service and can really be beneficial in you and your loved one, really being in it together to help you on your journey and finding the best mental well-being.
Absolutely. I think also coming to terms with needing help might mean that you have higher expenses. We know that psychiatrists aren't cheap necessarily, and I know my understanding is sometimes non-traditional treatments, for example, at-home ketamine treatments, might not necessarily be covered by different types of health insurance. I know that you can use your HSA and FSA, though accounts for almost anything medically related, whether it's traditional or non-traditional, but are you aware of any more traditional health treatments that might be covered by insurance?
Yeah, yeah. So fortunately, most of the traditional and even some of the secondary and alternative treatment options are covered by insurance. And so an interesting note, that I've found and kind of experienced is most people don't know, but a law was passed actually in 2008, commonly known as the Mental Health parity law or federal parity law, which requires coverage of services for mental health, behavioral health, and substance use disorders to be comparable to physical health coverage. So, for example, it requires co-pays for a mental health care provider to be the same as a medical surgical office visit. So, in general, this helps ensure that the cost of mental health services are feasible and accessible for those in need. And in terms of what is generally covered by health insurance, the traditional treatments, including psychotherapy, psychiatrist visits. So again, the doctors that can prescribe medications, the medications themselves, inpatient treatment programs, partial hospitalization programs, outpatient services, emergency care, rehabilitation, addiction services. So those are all more of the traditional treatment options, and those are really, really commonly covered by insurance. And then your insurance, it may also help cover some of those alternative forms of treatment, such as homeopathy, naturopathy, massage therapy, acupunctures, chiropractics, hypnotherapy, as well as other medical treatment modalities that are done through your doctor, such as electric ECT, so electroconvulsive therapy, ketamine infusions and Spravato, transcranial magnetic stimulation, so TMS, which is a more newer treatment for depressive disorder, and many more. So again, there are some of these alternative treatments that are covered by insurance, and you can pay with your HSA, FSA. You can always request a super bill, and that could potentially get reimbursement from your insurance coverage. But it really does come down to the clinical indication and diagnosis for which you receive these, the treatment provider, the credentialing and billing done by the provider, as well as your insurance company in general. And so there are, again, that's just some examples of the traditional and alternative. So I'm definitely missing some treatment options and factors that lead to the ability to get coverage. But really, it again circles back to the best practice is to reach out to your insurance company as well as the provider of those treatments, and kind of gather information, work alongside them. There is a lot of support in kind of identifying what treatment options are covered by insurance. And so again, there are a lot of options that are affordable and accessible, and a lot of support that can really help you find the care to focus on your well-being, because it just is so critical.
I agree. Well, Joey, like I thought that this was such an important topic for us to address today because mental health, it could affect your work productivity and ultimately your retirement plan long term. It's not just a short-term thing, it's also a long-term thing. And so understanding the impacts as an individual, I think is very important for our clients to know because it'll only help us as financial planners on developing strategies on managing those risks associated with a retirement plan and creating more flexible financial plans for you and securing adequate insurance coverage where we help with Medicare supplement services and just planning for potential income fluctuations is really where I'm coming from a financial advisor perspective. But again, like I had said a couple times, I'm so naive to this. I'm so happy that you were able to speak a little bit further to this topic in general. Thank you, Joey, for joining us today. It was a pleasure on having you on this conversation in the professional mental health space here. So thank you for your time.
Absolutely. Yeah, it's been truly an honor to be on the podcast and speaking with you both, and just allowing me to open up and share about my own kind of experience in the space, some of the education and knowledge and wisdom I've gleaned from my own journey, as well as working alongside other people. And really, if anybody needs any support, again, there's so many resources, and focusing on your mental health, it's something that's although it's taboo and something that's not often openly accepted, although increasingly so now, which is really great. Not to get to too far to the one extreme where it's been uh, overwhelming in conversation, but again, really focusing on your mental health, it does tap into that physical aspect. It allows you to spend your retirement time really living the best life possible. And that's something that I've experienced, is once you start to focus on your mental health and even just give it some attention, and finding that self-care practice and finding others to connect with and opening up and being vulnerable, it's really something that is life changing. And not just having the extra years on your life, but making them quality years, and being able to spend the money on things that you really truly love, and on the values that you can reflect on by doing the introspective work.
Mhm.
It really comes back to finding that best, your best self. And so being able to provide information to help people do so is something that I'm just so passionate about, and I'm really lucky to be able to share that on this call with you both.
Yeah,
Oh,
that's
thank you, Joey.
fantastic. You've given us so
Yeah.
much great information, and I can tell that you're really passionate about this topic, and it's so important for people. And I think one of the main messages is, don't put it off or hide it. Be willing to face what you're going through and work with professionals to get the help you need, right?
Yeah, it's truly a strength to face it. And
Yeah.
so it's although it's kind of that hardcore mentality of put it off, it is yeah, a lot of the patients I work with and talk with is like, I didn't realize this is the real challenge in life, is like actually like facing it and
Sure.
working through it. But it's provided them with so much strength and so much challenge
Mhm.
that bleeds into every aspect of their life, and really makes life so special, and it helps people to tap into communities, tap into relationships, be present in the moment, and enjoy life to its fullest. Because I think that's what we're all truly here to do, and it helps people fill their own cup so they can pour into others.
All
Oh, I
right.
love that.
Yeah, that's great.
To wrap up this month of just talking about mental health and just wellness and health, I guess in general, Paladin is having an in-person client educational event on the challenges of aging. That's coming up Monday, September 9th, where we're going to have another outside speaker focus more on the health implications and how it can be addressed in a financial plan, and help servicing with some options on how to fix that. So we'll further discuss planning for healthcare costs now, and how important it is in achieving that financial security in your retirement.
Excellent.
I'm
Yeah, I know
excited
you
for it.
have that coming up. And if
Yeah.
people want more information on that, where can they go?
You can go to our website, paladinfinancial.com, where we have a drop down on upcoming seminars, webinars, educational events. So you can register there and bring a friend if that is of interest to you, or you could give us a call to register. So 651-842-8406.
All right. Well, great show today, Ellie. And what a great guest, Joey.
Thank
Thanks
you,
once
Joey.
again for taking the time and letting us have you on the show.
Yeah, thank you so much, Tony and Ellie. I really, really appreciate it. It's been
Yeah.
a
Of
it's been an
course.
honor.
Enjoy
Excellent.
that California sun.
Yeah, we're jealous. We're jealous. All right. And that does it for today's episode of Paladin Financial Talk.